Hi everyone, welcome to the NIHR School for Primary Care Research PPIE and Practice series, where we share snapshots of the public involvement and engagement activity happening across primary care research. Joining me on today's episode is Dr. Rosina Cross, a postdoctoral research fellow at the University of Exeter. She's here to share more about recent research she's been involved in on postural hypotension. Rosina, thanks so much for joining us. Can you tell us what postural hypertension is and what the project you were involved in was about?
Of course. Thank you, Hallie. So a drop in blood pressure when a person moves from sitting or lying positions to standing up is called postural hypertension. And postural hypertension is associated with complications such as memory problems, falls, and an increased risk of early death. The risk of these occurring, however, can be reduced if postural hypertension is identified early. And although we know that postural hypertension is common, especially in those aged over 65 or above, the actual number of recorded diagnoses in primary care patient records is much lower than what we would expect from the numbers seen in studies for postural hypertension. Doctors, nurses, healthcare assistants generally only check for postural hypertension if a person reports symptoms, and these symptoms could be feeling dizzy on standing and fatigue. However, more than half of people with postural hypertension don't report these sorts of symptoms. And this means that many cases of postural hypertension are unlikely to be detected if doctors and nurses are only looking for it based on patient-reported symptoms. In primary care, postural hypertension is usually checked by asking a patient to stand from a sitting position, and the amount of blood pressure drop that is usually recognized as postural hypertension is based on a blood pressure standing up from a lying position. And the drop in blood pressure from sitting to standing is typically smaller. This difference means that not all people with postural hypertension may be picked up by following the current guidance. So our project aimed to understand how postural hypertension is currently being tested for across primary care services, and to further explore what primary care doctors and nurses understand about checking for postural hypertension. So at the early stages of developing the project, we involved 5 public partners with interest in and/or experience of postural hypertension. They were recruited from Peninsular Applied Research Collaboration Patient and Public Engagement Group and from previous collaborations on related blood pressure projects. The public partners highlighted the importance of the topic area and helped us to reappraise the scale of the proposed work in relation to the funding envelope. They also helped us ensure the clarity of our plain English summary and provided advice on how to meaningfully integrate involvement into the research project and how to disseminate findings meaningfully. 2 of these public partners continue to be immersed in the project management team as public co-applicants for the duration of the project. And in their role as co-applicants, they engaged at regular meetings across the project where they discussed and challenged ideas with the rest of the research team. They were also involved in all aspects of the project, including reviewing and providing feedback on our ethics application, participant recruitment and consent materials, survey questions, and interview topic guides, as well as our data analysis plan. Public co-applicants were also involved with coding and data analysis, which is quite novel, as well as producing the plain English summary and dissemination plans for the findings of the study.
It's really great to hear how much they were involved from the start to the end of the project as well. And I guess reflecting on this, what impact do you think the involvement activities have had to date, on you, your project, and those involved as well?
Overall, the involvement activities and advisors have had a substantial as well as positive impact on the study and the research team involved in facilitating the project. Having their involvement from the outset was vital, both in confirming that our research ideas were relevant and important for patients, as well as ensuring that our proposals focused on the most relevant research questions for the patients. Their involvement across the project ensured that decisions were always made with the interests of patients with postural hypertension, and that our research documents were clear, concise, and accessible to our participants. Their contribution to development of our survey also added clarity and focus to the questions. And lastly, their involvement in analysing our interview transcripts, which again, as I said before, was a novel approach, ensured that interpretation of results were analysed and discussed from different perspectives. And we believe that we've developed a feasible and meaningful approach for involving members of the public, which we will draw on for future research projects.
Being through this all yourself now, I guess what advice about public involvement would you give to share with others to help them facilitate involvement in their projects?
I think firstly, using a small team of public partners works well. So a team allows individual advisors to support each other and build confidence that their input is relevant and valued through their shared experience. Also, and importantly, they're volunteers. They cannot always manage to attend every meeting. And so sharing the role improves continuity through the research process. Secondly, being flexible in your approach and being willing to adapt and respond to public partner feedback. So at the request of our public partners, we organised and undertook pre-project meetings ahead of the main project meetings with the full research team. And we found that in previous projects, these meetings worked best when they occurred close to or immediately prior to the whole team meetings. And the aims of the pre-project meetings were to review the forthcoming agenda and papers, to answer any queries the public partners had ahead of the main discussion. And this worked well for everyone. It allowed clarification of ideas and discussion points for both the advisors and the researchers. It reduced the number of interjections during the main project meetings because there was a higher level of prior understanding. And I think it also empowered public partners to be more confident in questioning researchers and contributing to discussions during the main research meetings. I think thirdly, keeping communication open is incredibly important. So regular attendance at project meetings and communication via email throughout the project facilitated good working relationships. It created a comfortable environment for open discussion between us and the advisors. Fourthly, being willing to challenge yourself and try new things. So initially we found it very challenging to explain the concept of qualitative analysis, and we were unsure how to involve our public partners in this data analysis. We subsequently created a how-to guide for coding interview data that was reviewed and used by our public partners. And after some problem solving with the public partners, we came up with a solution for them to help us with the coding of interview data in a way that was accessible to them. And this involved them adding written comments in Microsoft Word on anonymized transcript and posting them back to us. Ooh. In brief, we have papers submitted to various journals. Findings from the research have been used to inform updates to the NICE guidelines, to add clarity to postural hypertension testing recommendations. Further SPCR funded projects looking at patient perspectives on postural hypertension and exploring their views and symptoms are underway, as well as further work looking at how blood pressure drops on standing from sitting might best indicate postural hypertension, as well as planning of primary care studies to better diagnose and treat postural hypertension.
Wow, a lot to look forward to in the future. Thank you very much for joining us today.
Thank you for having me.